Is PRP pro-inflammatory when microneedled into the skin? I'm doing some research on which products are the best for microneedling, and have come across some information that PRP is actually not great with microneedling because it is pro-inflammatory and that most skin issues, rosacea, abnormal skin pigmentation, wrinkles, etc., are due to inflammation, which is less than ideal. Why would you want to induce more inflammation? Are human mesenchymal stem cells better because they are anti-inflammatory? I would love some expert opinions on this.
Thank you for your question. You submitted your question without a photo, and you are essentially trying to understand how the inflammation that could be associated with a treatment related to microneedling can be somehow aggravated by the use of platelet-rich plasma, or PRP. And certainly I can see how you are using appropriate logic to define the skin conditions such as rosacea, such as wrinkling and pigmentation issues as having some degree of inflammation, and so why would platelet-rich plasma be useful compared to other potential modalities? Well, I can certainly share with you a general broad explanation of the role of inflammation when it comes to different treatments. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been using PRP for many years, and I have in fact also developed a hair treatment for male and female pattern hair loss using PRP and a material called extracellular matrix. Part of everything we do in medicine and aesthetic field can be argued to have some type of inflammation. So I would first start by asking you to maybe even take a step back and look at the skin conditions that you want to treat and determine if microneedling is the right treatment for you. Microneedling is based on a principle known as collagen induction therapy. And what essentially you're doing with the microneedling process is a controlled injury. By definition, that injury causes inflammation. When you look at the process of wound healing, and everything from a simple cut to extensive surgery or laser procedures, there are 4 phases. There's an hemostatic phase, which is the sealing of vessels so that there's no bleeding. Then there's the inflammatory phase. Then there's the proliferative phase, which is the wound healing response, where there's collagen production, blood vessel formation, and then there's a remodeling phase where all this tissue is remodeled. The goal with any treatment we do is to see improvement. Now, I can certainly tell you that understanding that microneedling can also be controlled in terms of depth and aggressiveness, and thereby have different levels of inflammation. An expert in this area will always be mindful of staying on that line where there is a certain amount of inflammation which is necessary and will not result in worsening of a condition. And that's the line. The line is staying on the side where you get benefit as opposed to getting damage. And this challenge occurs in microneedling, occurs in lasers, occurs in a lot of different things that we do as aesthetic specialists. So it's about the judgment. And as far as PRP is concerned, I can certainly attest to the value of PRP with microneedling as well as many other treatments. When I do any type of laser treatment, like a fractional CO2, or I should say an ablative laser treatment, I use PRP to expedite the healing process. With microneedling, I do exactly the same. PRP will not cause worsening of inflammation. PRP will help recruit the wound healing factors in your skin to help expedite healing. So understanding that the conditions you described, like rosacea, rosacea is an inflammatory condition that leads to very sensitive skin. Generally speaking, I don't usually recommend any kind of aggressive microneedling in the areas where rosacea is active. And so that's a situation where you would not want to add inflammation to an area that's already actively inflamed. However, you can use lasers, such as lasers for vessels, to help improve the appearance of skin that is flushed and has little vessels called telangiectasias. Now, in that situation, you're using a laser that is inducing a certain amount of inflammation, but you're targeting vessels. And so you are using that inflammation in a way that is helpful. So it goes back to the idea of the understanding of judgment of what is right for your skin. And so microneedling being one option, and if you're dealing with aging changes such as solar dyschromias or brown discolorations, as well as wrinkling, well, you have a wide range of options in addition to microneedling. And as far as the role of PRP in these conditions, I can certainly say that PRP has only been a useful tool to help expedite and improve the benefits of any treatment that I do in a lot of different scenarios. For example, when you do a treatment such as, let's say you do injectable fillers, and you want to not only add volume, but then you want to improve skin quality. Well, then you can inject PRP, you can deliver PRP through different devices, and the skin benefits. So I think that it's important for you to, of course, always be educated and learn about the science and the principles. But when it comes to a treatment plan, I think you should consult with an expert, consult with a physician who can guide you with what it is you want to solve before you decide that, for example, like microneedling is the right thing for you. A lot of times people learn about different modalities and they come in wanting that modality, not appreciating the wide range of options there can be, and often missing the forest for the trees. So it is very important to find a doctor who can educate you, and as is often the case in my practice, I've become the primary care doctor for beauty for my patients. So we deal with a lot of facial aging issues and skin issues, and so very often when I evaluate my patients, I first take pictures, I review the photos with them, and then I talk about options to help them see benefit. And I essentially use a very straightforward approach. I start with the foundation, which is the bone structure and volume, and then work my way outward to the skin. So meet with someone with expertise with these areas that you're interested in, of course, such as PRP and microneedling, and see what's their take on this. And understand there are many variables that are at play in terms of managing inflammation, but certainly I would not be concerned about the inflammatory effect of PRP, but rather the many benefits of PRP, but also understand the limitations and find a strategy that works best for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.